Returning to the Foot and Ankle Orthopaedic Surgeon. Today we're going to talk about bunions and minimally invasive bunion surgery and how this is done. It's known as a hallux valgus deformity, and typically the toe points away from the middle of the body, as is marked by the red line here. The toe should be sitting where that blue line is, but it's sitting in a different position. That's usually due to genetics and footwear over time. As I mentioned, it's known as a hallux valgus deformity from a medical point of view. Typically, the problems with this is that little bump on the big toe side of the big toe rubs with shoe wear, or the big toe can rub against the second toe, causing ongoing pain to the patient. And usually, if they've failed non-operative measures, they may consider surgery. One of the non-operative measures is toe spacer, which pushes the toe in a better position. It is not a permanent fix, as the toe will go back to its normal position when the spacer is removed. This is an X-ray of a hallux valgus deformity or bunion deformity, and I'm going to mark out what causes the deformity. We're just marking that big toe in yellow there. That's the outline of the big toe, and we're particularly referring to the first metatarsal. That's the important bone in terms of a bunion deformity. You'll notice that the other metatarsals, these are the long bones in the middle of your foot, are in this position, which is marked by the red line there, whereas the first metatarsal that we've marked is heading out in a different direction. It's heading out more towards the middle of the body, away from those other metatarsals, and this what often causes the problem in terms of bunions in most patients. It should be more where that white line is, or closer to that white line, and this is what the surgery is based on. So the severity of a bunion deformity is determined by something called the intermetatarsal angle. That's how surgeons work it out, and that's a line drawn down the first and the second metatarsal, and the larger the angle is, the worse your bunion is, and we're trying to make that angle smaller with the surgery in order to bring your toe back into a better position. And one of the ways we do that is by moving that first metatarsal closer to the second one. And this is what the surgery is all about. So this is that bunion x-ray again, and the way that we sort of help to remedy the problem is we use something called a burr, which is this silver thing that spins at really high speed and creates a cut in an area known as the metatarsal neck, which is shown on the diagram on the right here. So once we've formed that break there, we can then move that what we call metatarsal head, so the round part, closer to the adjacent metatarsal. So you'll see on the right there that head's been moved across, and we'll do that with a finger. And what that does is that reduces the angle, or makes smaller the angle between the first and second metatarsal. So if we compare, before we started, which is on the left there in red, compared to when we've moved the metatarsal head, the angle is now smaller in the yellow side, which will straighten the toe, and you can sort of see that on the x-ray there already. But we've got to hold that head there. If we just leave it there, it's just going to move back. So the way we hold it there is with some screws. So we're just going to draw where they would go on the x-ray there in blue, but we're going to show you an x-ray here on the right, which actually shows what the screws look like. So that's them there, but you'll also see on the x-ray this one's actually got two extra screws, and so this patient has had something called an Aiken osteotomy, which is a little break they put in the toe, in the bone that's just above the metatarsal, known as the phalanx. And on the left x-ray here, you'll see that little yellow wedge. So we take a little wedge of bone out there, and then we bring the two edges where the yellow bit's been taken out together. Some patients will require this if the toe's not quite straight enough after performing the procedure, the first metatarsal, and then so we close it up and put a screw across it, like so, just there, and the x-ray on the right is typically how it looks like. This type of procedure is with much smaller cuts, so you can typically expect about 5 cuts in total. They're about 1 centimetre each. This will vary from surgeon to surgeon. You'll also find some surgeons perform different procedures to correct the bunion, and it's best to have a chat to your surgeon about which they think is best and why they perform a particular procedure. But this is how I typically do it, and this is commonly how it's done. It's typically effective with about 5 little cuts around the foot. But in other videos, we'll talk about the recurrence rate or the success of the procedure. Thank you for listening to our video. Please take a look at some of our other videos if you're interested. We really appreciate you watching our videos, and please subscribe to the Foot and Ankle Orthopaedic Surgeon. Once again, thank you for listening today.